News now from Gorakhpur after the hospital horror there and the public outrage. The UP Chief Minister and Union Health Minister Nadda will be visiting Gorakhpur today. Over 60 children died in the last 5 days, many of them allegedly because of an oxygen shortage at the hospital. The UP government suspended the hospital chief of Gorakhpur's BRD Medical College and Hospital, making him the fall guy for the tragedy, though he claimed he had written letters since early July asking for funds to be released for the payments to the oxygen supplier. And after the initial denials, the UP government finally admitted to a no oxygen situation at the hospital on that fateful evening. We spoke to Health Minister Nadda, who was on his way to Gorakhpur, who said that action will be taken, who also spoke about how encephalitis among children has been a major issue in Gorakhpur for years.
I have with me Union Minister Nadda travelling to Gorakhpur right now. Sir, you're travelling, there have been a great loss of lives. What are you hoping to the probe to go forward?
CM of Uttar Pradesh, Yogi Adityanath has very detailed, he has given a report in the sense that he has talked to the press yesterday and he has given in detail what has happened there. We are there to support the state government and for that I am going. As far as the incident is concerned, the UP Chief Minister is personally looking into it and going into the details of it. He will find out what are the reasons, number one. Number two, as he has assured, and we are confident about it, that the action will be taken accordingly. But support from our side is concerned. We have done a lot in the past 3 years as far as the Japanese encephalitis is concerned. Whatever has been asked by the state government, we have provided. We have provided them. We have also added Japanese encephalitis for adults also in our universalization of the immunization program. So in the universal immunization program also it has been added. The ICMR center, which is continuing there, we are enhancing the facilities there also as far as the research is concerned and as far as the support to the state government is concerned. But here in this incident, I am just going to support the state government and whatever possible things are being done.
But still, Gorakhpur has always fared very badly when it comes to encephalitis cases. Is it that studies haven't been able to find out the correct strains, or is it the lack of administration at the hospital?
As far as Gorakhpur is concerned, I'm been attached to the whole subject for the past 3 years. Yogi Adityanath, as Member Parliament also, has been raising this issue and he has been fighting. Whatever facilities are there in the BRD Medical College, it is because of his own personal efforts. He has raised the issue in Parliament many times and that is why those facilities are there in place. As far as the issue related to this incident, we can't comment, at least I can't comment so long as I do not go to the reports of the But yes, as far as the administration is concerned, the Chief Minister has given a very straight statement that action will be taken against those who have found guilty.
But for the longest of time, we kept denying that there was no oxygen shortage. There are other reasons. But even if there are other reasons like open defecation and such, isn't that still a question on, that the state government hasn't been able to control those?
You can't think that in 6 months or in a short span of time, the emphasis by Yogi Adityanath has been immense and he has been trying his very best and all his ministerial colleagues and the whole government is trying for it. It needs to change in the attitude of the people. It needs the support of the society and that needs a lot of cooperative effort, collective effort from all sides, and I think that is going to be in the change.